Hello and welcome to today's episode of Life-Saving Procedures. Today we are going to be discussing ingestion of battery in children, be it a cylindrical battery or a bottom battery. Now it is important that we note that the ingestion of battery in children is a medical emergency with dire consequences. The best action you can take when it comes to ingestion of battery in children is to prevent children from having access to batteries. What this means is that if you must get a toy that uses a battery, it's important that you go for toys whereby the battery compartment can be properly secured with a screw. Okay, if you have clocks that use battery or hearing aid or any gadget around that uses battery, it's best for the sake of your children or any child around that you go for devices that the battery compartment can be properly screwed, thereby preventing children from having direct access to batteries. Remember again, the best action you can take when it comes to the ingestion of battery, this very dangerous substance when it is within the gastrointestinal tract of children, is to prevent them from having access to this. Now, in the event of an accidental ingestion of batteries, what do you do? Few symptoms and signs that you might notice when a child ingests battery: from coughing to vomiting to drowsiness to confusion. Some can even have seizures. Okay, it is important that you carry out this step I'm about to mention before you get to the hospital. When a child ingests battery, please and please do not sit at home waiting for the child to pass stool before you know the next step to take, or you wait until a complication develops before you get to the hospital. Most times, within the immediate period where they ingest this battery, they might not have any symptoms. Okay? That does not mean you should sit at home and wait until symptoms develop. No. As soon as you come to the awareness that this child have accidentally ingested a battery, please take this child to the ER immediately. Take the child to the hospital immediately, because this battery must be removed as soon as possible. Why is this important? When batteries get ingested into the gastrointestinal tract of a child, what this battery does is that it causes a chemical bond that we refer to as caustic bond, okay, or alkaline bond. It causes a chemical bond that we refer to as caustic bond or alkaline bond. What that means is that this bond is the type that it continues to melt through the tissue, and this will continue for as long as the battery remains there. And that's why one of the feared complications of ingestion of battery is death. It can cause death because it can melt through the wall of the esophagus, causing perforation through the esophagus, causing perforation through the trachea and any other soft tissue surrounding where this battery is at the point of transition through the tract. And that is why time is important. It takes just 2 hours for this battery to completely melt through the wall of the esophagus. And this is why timing is very important when you know or you come to the realization that the child around you have ingested a battery. Now, what can you do on your way to the hospital? On your way to the hospital, if you have honey, you heard me right, honey. I say it again, honey. If you have honey within your reach, please, on your way to the hospital, administer honey to this child. Give 1 to 2 tablespoons of honey to the child on your way to the hospital. And if you do not have honey at home, please, that's not the time to go and start looking for honey. It is the time to run to the hospital. This battery must be removed as soon as possible, okay, from the system of the child. Please, I reiterate, do not sit at home waiting for the child to pass this battery. For every single minute that passes with this battery in the system of this child, you place the child at risk of chemical burns through the tissue that this battery is found. Give honey. Why is honey important? It has been found that when you give honey to a child who just ingested battery, what the honey does is to go and coat this battery, thereby preventing or reduce or slow down the reaction this battery undergoes in the system of the child. Okay, so honey is very important when it comes to ingestion of battery in children. Give honey while you run to the hospital. Every 10 minutes, you give 1 to 2 tablespoons of honey every 10 minutes, depending on how far the hospital is to where you are located or to where this event occurred. I repeat, give honey 1 to 2 tablespoons of honey every 10 to 15 minutes on your way to the hospital. Ensure you get to the hospital as soon as possible so that all hands can be on deck to help remove this harmful substance from the system of your child. Why is this important? A few complications cause perforation, difficulty with eating, with swallowing, with taking anything, losing important fluid, respiratory distress, if it boils through the trachea. Okay, a lot of complications that can occur when a child ingests a battery, including deaths. And this is why time is very, very important. Ensure you get to a proper hospital. This is not the time to start running to the chemist. Ask neighbors what to do. What you should do is to run to the hospital. But on your way to the hospital, take your honey with you. Continue to give 1 to 2 tablespoons of honey as you make your way to the hospital. I hope this helps someone. My prayer is that we will not witness this kind of emergency, but if it happens, your action, your quick action can help improve the chances of survival of the child. Cheers.